All right. So thank you, everybody, for joining us today. My name is Hallie Leinhardt. I'm the Outreach Specialist for the Center for Financial Security here at the University of Wisconsin-Madison. Thank you so much for joining us for today's webinar. This webinar will be a presentation on the findings from a student loan debt repayment counseling program. And our esteemed presenter is Vicki Jacobson, Director of the Center for Excellence in Financial Counseling at the University of Missouri-St. Louis's School of Public Policy and Administration. Previously, she served as the president of the Foundation for Credit Education prior to its transition as a center at the university. During her tenure with the foundation, she worked with the student loan law experts to design and deliver training to nonprofit credit and housing counselors on student loan borrower repayment. Vicki has served in various management roles for the Regional Consumer Credit Counseling Service of St. Louis as well. And just a reminder before we get started with the presentation, to submit questions to be answered in the question and answer portion that will take place in the last 10 minutes of the webinar approximately. Please submit your questions in the Q&A box located on the left side of your screen. And with that, I will turn it over to Vicki.
All right. Thank you, Hallie. Appreciate that. Hi, everyone, and I'd like to thank Michael Collins and the Center for Financial Security for inviting the Center for Excellence in Financial Counseling to present our Student Loan Borrower Repayment Counseling Pilot Program findings. We're pleased to present these findings so that we can all learn how to do even better in providing services to borrowers. I do want to note that this is a self-funded program that targets financially distressed borrowers in repayment, that it's not exit counseling, but it's for borrowers currently in repayment. Today we're going to do a quick look at the current state of student loan debt in the U.S., and many of you are probably already aware of the problems. Do a brief overview or look at it, provide you a brief overview of our program design and implementation. And of course, we'll look at the highlights of the evaluation findings. And finally, note lessons learned and where we plan to go from here. Just quickly, as maybe many of you already know, borrowers owe over $1.2 to $1.3 trillion in student loan debt, and of that, about 2/3 of it is owed by borrowers under 40. But I think one aspect that we have to keep in mind that approximately $18.2 billion is owed by borrowers 65 and older. About 40 million borrowers, according to Experian, have at least one student loan. It seems like everyone knows someone who has a student loan. 700 retirees on Social Security are repaying their own student loans. And last year, 160 retirees, Social Security was garnished for student loan repayment. Unfortunately, about 7 million borrowers are in default. Keep in mind, default is that they've missed payment for over 270 days. What's interesting about the number of borrowers in default, or the total balance that's in default, 51% owe less than $10,000 each. We're led to believe that with all the large student loans amounts out there, that those are the ones that are in default. But actually, the opposite is true. It's borrowers who have very little student loan debt by comparison that are in default. And unfortunately, many of those have probably not completed their education. So not only do they have the burden of the debt, but they also have, do not have the benefit of their education. The next two bullets point to delinquency. We've got quite a few, 3-month delinquents as of June 30th. And when you look at the overall from the Department of Ed, that reported, I think it was the end of June, that of the 55% that of the total debt that's in repayment, approximately 23% of that has a delinquency rate. In addition, quite a few borrowers are in deferment and forbearance, and the reason that put them in those, either deferment or forbearance, that problem's probably still going to be facing them as much as they get out as it did before they went into those deferments and forbearances. One thing that I think will help you understand the focus of this program is looking at the final bullet, that in 2012, roughly 51% of borrowers were eligible for an income contingent repayment plan. That, of course, is one that's tied to their income. However, because of borrowers' lack of information or not knowing about those plans, only 20% were enrolled. So part of the problem with the delinquency and the default would perhaps be lessened if people knew about their repayment plans. So one of the questions goes, what we want to ask is, where can borrowers go for help? Of course, there's the loan servicers where most people, think first to go for help. Loan servicers might not always know the borrower's situation in order to help them find the best repayment program for them. The Department of Ed has a lot of online tools and help and an ombudsman. Then there's well-intended providers that might not be as knowledgeable as they could be, but perhaps even a larger problem are the scam people, scammers who are setting up business. And they can charge borrowers hundreds of dollars for performing tasks that the borrower could do for free, provided if they only knew how to do it. So I think that's going to be a problem moving forward as far as scams are concerned. I want to provide you a quick overview of how long we've been working with student loans. Back in 2006, we contracted with the National Consumer Law Center to design and deliver training about repayment programs and what were available to borrowers and what their eligibility was. During that time period between 2006 and 2009, we trained approximately 400 financial counselors. That would be credit counselors and housing counselors. We provided that for free to the counselors. But what was troubling us was we were uncertain, or we were unable to determine, of course, if our training objectives were being implemented or being directed toward our target audience of financially distressed borrowers. So we decided in the second phase, or second stage, to provide to combine the counselor training with some program reporting. And we asked a few agencies or a few organizations to include student loan debt as they looked at a borrower's or at a consumer or a client's overall debt portfolio, if you will. And at that point, we noticed that it seemed like borrowers were more interested in, or clients were more interested in their credit card debt or their housing issue than they were their student loan. Mainly because a lot of them were already in deferment. But that also sent us a very clear lesson to be learned, that student loan repayment counseling had to be a standalone item, a standalone service. So given that, we looked at what else could we do to make certain that these training objectives were reaching our target audience. So we developed an approach that we could provide quality control measures on, and based on a framework that would help assure consistency of delivery of a treatment. So that's how we progressed into where we are today and presenting these findings for you. I want you to look a little bit at our program development. As we began working on our logic model, we conducted a literature search for trying to identify a financial counseling model that would assure and measure consistent delivery of a treatment. We were unable to identify any evidence-based financial counseling model. We could find none that was, slated as a financial counseling model. So we looked at exploring similar helping fields and particularly health education and counseling models. And we found a smoking cessation model that had been generalized and applied to a variety of settings for changing behavior, and it involved a lot of collaborative goal setting and working towards self-management and empowerment. And we decided to work with that model because it gave us a lot of flexibility and still reached our goals. That was wonderful. Now we had a working model, but we also recognized that we needed to train counselors in how to deliver that model. So we worked with the Counseling and Family Therapy Department here on campus to develop counselor communication skills training that would support the counseling model of behavior change. And that training was about a day-and-a-half training that we delivered personally to each of the participating organizations, which we will talk about shortly. And we again contracted with the National Consumer Law Center to provide the technical training in student loan repayment. And that was a series of 5 webinars. And as a part of that, we also developed a checklist for identifying a borrower's available repayment options. It's basically a process of elimination for options available, all the way from canceling the loan to challenging the collection. In addition to that, we provided kind of a unique component, if you will. We included legal consultation if a borrower needed it. So we worked with legal service organizations to participate in our program, and I'll go into a little bit more detail on that as we move forward. And as we planned this program right from the very beginning, we worked on program evaluation so that was built into the whole process. It wasn't something that we were doing after the fact. So that's a brief look at our overall program development. Now taking a very quick look at our first session of counseling. We wanted to know what brought the borrower into counseling. If there's something that had happened that prompted them to seek assistance. And we also wanted to know what the borrower had done so far to address his situation, because that can make a big difference in where we started our process. We also wanted to know what their goals were with respect to student loan repayment, particularly if they wanted to return to school, which is a really important factor. In order to work with the borrower, we needed to have their current information. We needed to know just what loans were in default, what loans were current. So we asked that they access their National Student Loan Data System printout or summary of their student loans. In addition, a lot of times there might be a loan that a borrower forgets and it goes into default and they don't know it until it's too late. So that was a real important aspect of the counseling, was to have that National Student Loan Data System for their federal loans, that system summary, I'm sorry. And for private student loans, the credit report, and we encourage them to access their annual free annual credit report so they would know about their private loans. And of course, any paperwork that they had on any of their loans, we asked that they bring that as well. But knowing whether they are in default or not in default was really a huge determining factor in identifying their possible solutions for their student loan repayment. We also conducted a lot of intake things, asking military service, veteran, those sorts of things that would affect possible student loan repayment options or areas that we could explore. An important aspect of the counseling is the action plan development. It's evolving throughout the counseling session, and a very important thing of pulling together and assessing, advising, and getting agreement on some goals that and tasks that would be established in the action plan. And in addition to that, and assigning tasks both for the federal student loans, private student loans, and money management. We also identified barriers that the borrower might perceive in accomplishing those tasks and what their confidence level was. And we tried to do this in within a period of time, particularly if the borrower was going to schedule his follow-up session, say, in 3 weeks. Could he accomplish these tasks in the next 3 weeks, and what would be his what would he perceive to be any barriers in accomplishing that in that time period? and what could possibly be done to remove those barriers, and what was his confidence level. And all of this information that's being compiled in the action plan is the progress is going to be monitored in the follow-up session, so that new tasks could be developed, see where the progress is on the part of the borrower, and schedule the next follow-up session, again, depending upon what kind of help the borrower needs and would be helpful for them and what they're capable of doing. If a borrower needed legal consultation, that was probably the next step. The intake form that the counselors used also had the opportunity for borrowers to give their permission to have the intake form or intake data sent to the participating legal services attorney so that that could be reviewed prior to meeting with the borrower. And as the program evolved, we found it best to leave the, trying to get with the legal consultation, the attorney and the borrower, we left it to the two of them to try to get together. And we'll talk about what kind of success we had with that as well. There's a lot of things that are different from this, for this counseling program that we've established that's quite different from traditional counseling. I've mentioned the emphasis on the need for scheduled follow-up. This is really important. In fact, we tried to have the protocol include, or we had in the protocol, that counselors established the follow-up session with the borrower before the first session concluded. It's very important to have that follow-up. Evidence-based practices in the field of professional counseling shows, or the research shows, that the greater rapport and the better the relationship developed between the counselor and, in this case, the borrower, the greater the counseling outcomes and the benefits for the borrower. So we really are very committed to providing more than just a one counseling session, encouraging borrowers to come in for at least a second counseling session. Then as far as the action plan development, I've mentioned previously on the previous slide a little bit about that, but that's probably one of the bigger motivation tools that we have to get the borrower to take action. I think it provides the opportunity for not only monitoring the progress and opportunities for building rapport, but to recognize success and to provide encouragement to take the next step. So I think a crucial aspect is the motivation of the borrower, and the best tool we have for that is the action plan. The partnership with the legal services provider really helps us provide a complete service for the client borrower. It's kind of a one-stop service, although that doesn't mean that necessarily geographically that the legal services person is located with the counselor, but the borrower may be more comfortable meeting with the financial counselor initially than with an attorney. So we wanted to make legal consultation quite accessible to the borrower, and that would be for situations that, say, a borrower's having problems with a school, a closed school, or say false certification, something of that nature. One other aspect of the program then that the legal services attorney was able to serve as a mentor to the financial counselors, so that if the counselor came across a situation that they weren't quite sure of or what direction they should go, they were able to utilize the legal services partner as a mentor. So that was very helpful as far as the program moving forward. Another thing that's very different is really the close monitoring of the protocol. And it's important, I think, to have a protocol that can be monitored. So again, that the consistency of delivery is going in the direction that it's supposed to, and that that the same consistent treatment or the same delivery is going for each borrower. That's terribly important for maintaining quality. And the professional third-party program evaluation is a way for us to know if we're meeting our objectives, our fidelity to our protocol, exposes retraining needs, needed program revisions, and of course, we're able to identify valuable lessons learned so we know what to do in the future. Our program implementation started off with, of course, not only developing the program, but recruiting first-rate community service financial counseling organizations. We purposefully looked for small organizations, again, that were community service-based. And they had to be very flexible in their reporting the data that CEFC needed. And because of their diligent work, we're able to report these findings. The organizations we worked with and their legal services partners, we worked with Urban Edge, a community development organization in Roxbury, Massachusetts. And they were partnered with Harvard Law School's Legal Services Center. And the second group we worked with was the Lutheran Social Services Financial Counseling in Duluth, Minnesota. They were initially partnered with the local legal services and later with the University of Minnesota Law School Clinic. And our third organization is Clarify in Philadelphia, which was partnered with Community Legal Services in Philadelphia. And again, for all of their fine work, we have this data to report to you. We worked with establishing of course, we established a memorandum of understanding with each of the six. They agreed to provide the service free and as a separate service from any of their other services. And of course, there was all kinds of reporting monthly, various reports sent in. CEFC, this is a self-funded program. We provided monthly base stipends to each of the six organizations and monthly performance-based stipends. And that was based on number of counseling sessions, first counseling sessions, and number of second, third, or fourth counseling sessions. So we really wanted to provide an incentive, if you will, for counselors for those subsequent follow-up counseling sessions. So there was quite a bit of reporting and compensation for following the protocol. We also worked with a small marketing effort. We pretty much left the marketing efforts up to each individual financial counseling organization because we determined that, of course, they knew their knew their community best. We did provide some templates and letters to other nonprofits to let them know that the service was going to be available. And we spent the first 2 months of the year 2013. We spent January and February working on the marketing and conducting the counselor and attorney training. We did not start counseling the first year until early March of 2013. The counselor training, as I mentioned earlier, consisted of 5 webinar sessions conducted by the National Consumer Law Center. And the attorneys and counselors attended all the webinars. That was a requirement. I think it's important to note that not necessarily do attorneys know very much about student loan repayment, so it was important that they become trained as well. The counselor communication skills training was delivered in person. I think I mentioned previously that it was a day and a half, and we traveled to each location, and the training consisted of role-playing and making certain that counselors understood the counseling model and the motivation needed to make the program a success. As I mentioned, there was quite a bit of reporting monthly, and monthly the borrower files were reviewed, and these are basically the intake forms that the counselors used, and we reviewed those monthly, and they also sent in monthly reports, and those were reviewed. And upon review and finding things that we knew we needed to work with, we conducted counselor and attorney teleconferences monthly. We did those with each of the 3 partners, if you will, And we did not bring all 6 together because we figured that there were enough differences between the communities that it was probably just as well and save time to work with each group or each partnership separately. In addition to the monthly reports, borrower surveys, and I'll talk a little bit more about that in a few slides, but borrower surveys developed by the third-party evaluator were distributed about a month after the borrower was counseled. So that was another part of our protocol and part of what needed to take place. So that's our program implementation. Now I'm looking at our program outputs. This is what we were able to accomplish in a 25-month pilot. We counseled over 1,200 borrowers. And let me explain why it's a 25-month pilot. As I mentioned, we counseled beginning in March of 2013 for 10 months of the year 2013. And 2014, we were able to counsel for 12 months. And then basically the pilot was over, but one organization, Urban Edge, was able to find funding to continue for another 3 months. And so that's why it's a 25-month pilot. Of the 1,200 borrowers, we had about 1,051 borrower files that contained data that we could analyze. Roughly 80% of the borrowers that came for counseling came for only one session. 20% participated in multiple sessions. We had one borrower that came in for no less than 8 follow-up sessions. Some of this is for knowing how they have to keep up their contact with the Department of Education as far as any like IBR or any other thing where they have to keep constant up-to-date information. About 11% of the borrowers sought legal consultation, and this was difficult for us to count this in that there was a great deal of privacy. I want to stress that the borrower's privacy was considered at all times. As the borrower was coming in through the financial counseling organization, we wanted to honor that privacy, and anything that came to us was with permission only. As we sent out the borrower surveys, we had permission from the borrower that it was okay to contact them for their feedback on the program. And of course, the legal services attorneys protected the confidentiality of anyone who came to them. So these are the numbers that we know went for legal consultation from the program, and we hope in the future that that number is even higher. I think there's some reluctance on the part of borrowers to seek legal consultation. Interestingly, though, for the entire program and the entire time period, we counseled borrowers that had a total of about $65 million in student loan debt. All right, let's look at the demographics of the borrowers that we counseled. The majority were under age 30, which kind of goes with the national numbers of the majority being under age 40. But what we were surprised at, that the next most concentration as far as age group was concerned was in the 51 to 60 age group. That was really quite surprising to us. 80% of the borrowers that we counseled were employed full-time of some type. But less than 50% had a job in their field of education, so that they were fully using their education. That's a kind of a startling number, and in some ways not. The majority of borrowers had a monthly gross income between $2,000 and $4,000, with the highest concentration falling below $3,000. We were able to determine that about 51% completed their education, meaning that they earned a degree or certificate. However, 31% had not. And about 17% did not indicate a completion status. One reason that this was difficult was because of a borrower having multiple degrees or having a say, an undergraduate degree and working on a graduate degree, or have one certificate but didn't finish it and maybe working on another. So there were all kinds of reasons for there being some discrepancy there. Perhaps most interesting is that across the board, the majority of our clients were women. Okay, looking at repayment status, pretty much parallel to what we see nationally. Slightly 20% of borrowers for both the years of 2013 and 2014, about 20% were in default. In 2014, we had about 45% in deferments, which was double the previous year. Must be that deferments were becoming popular, or at least more popular. We were getting the reports on that many borrowers were in deferment. As far as private loans are concerned, for both years, and we weren't able to collect as complete a picture as we would have liked on the private loans. Oftentimes, a private loan was maybe being paid by somebody else, but 40% of what was reported to us had a cosigner. And 10%, and of those balances, for 10% of them, the cosigner was the one receiving services. We had several situations where apparently the cosigner and the borrower had become estranged, or cases where a grandparent was a cosigner and didn't realize it, situations like that. So that presented a huge challenge for counselors to be working with just the cosigner. Interestingly, though, the bulk of the private loans were held by borrowers under age 30, and about half of them were current. As far as their unsecured debt is concerned for borrowers, approximately a third of borrowers were not current on other unsecured debt, and for those in default, the percentage was over 60%. Among borrowers not in default, 64% reported they were current with their credit card payments. And by contrast, 24% of defaulted borrowers reported being current, with 61% indicating they were not current. There's some, relationship going on with credit cards and student loan debt. It seems like perhaps when you have one current, you don't have the other. And I know there's been some focus groups that, some borrowers feel that student loans, what are they going to do? Where credit cards, they can really do something. But I thought an interesting thing that came out of this was that almost 75% of borrowers were aware that filing bankruptcy would not clear their student loan debt. And I find that interesting, in that that is probably something that stuck with them from their exit counseling. So many borrowers knew that bankruptcy wasn't necessarily the way out, but still definitely an option for undue hardship. I want to talk a little bit about the Public Policy Research Center, who conducted our program evaluation, and how we came about doing it as we did conduct it. We explored using experimental design, where we would have a control group, but that became very unmanageable for us, and and hard to do, which is saying the same thing. But one of the bigger reasons is that we were not comfortable with withholding treatment from a borrower who came to us for help. We did not want to do that. So we then looked at pre and post test, which also was an issue for us due to that privacy issue that I mentioned. And it was, again, kind of difficult to do, providing this through a remote, in that, we were in St. Louis, and these organizations were scattered around the country, and a little bit awkward. So we did not do that and decided to go the survey route. We developed two surveys. One was way too long, and the second one was much shorter. I think I mentioned that we distributed the surveys through SurveyMonkey, and only with the borrower's permission. they were distributed through their counselor. So, we just provided the survey and asked them to distribute it. We distributed 846, and we had a return rate of about 22%. 186 borrowers responded to the survey request, which I think is fairly encouraging in that, many of us don't like to respond to things about something we're unhappy about, meaning debt. So we were pretty pleased with that. We wished it were higher, of course, but generally the borrowers were asked questions relating to their student loan situation and their impressions pre-counseling and post-counseling, particularly what they saw as the results of the counseling. And we also wanted to look at that level of confidence that they felt in dealing with their student loan situation after the counseling and after meeting with their counselor. Okay, here are some program highlights that we found on the survey. Nearly 39% responded that they knew about their repayment options for their federal loans prior to counseling. But after counseling, 87% indicated they felt better informed about their available student loan repayment options, which we felt very good about. 57% responded that because of the counseling, they discovered that they were eligible for a lower monthly payment and changed their payment. We were not able to confirm that, with the or verify that with the National Student Loan Data System, but hopefully in the future maybe we can arrange something so that we can. But we're pleased that at least 50% responded that they had done that. Over 53% of borrowers said that they were on time with their student loan repayments prior to counseling, but after counseling, 71% responded that they were making their student loan repayments on time. So that was quite an increase, and we're hoping that that's a good reflection on the counseling. Finally, 74% of counseled borrowers agreed with the statement, "I wished I'd found a counseling program like this sooner." And continuing on, 84% of borrowers responded that as a result of the counseling, they now trust that they will make good financial decisions in relation to their student loan debt. I think for a lot of borrowers, it provided balance for them on their student loan debt and managing their student loan debt along with their other finances. Over 66% of borrowers indicated they felt less stress about their student loan situation after the counseling. And I think this goes with some of the headlines we see nationally that over 90% of borrowers responded that their student loans kept them from achieving their personal goals. And, we're not sure. We asked that as kind of a generalized question, but it could pertain from home ownership, marriage, children, car purchase. But 90% felt that student loans were preventing them from doing that. As an overall, just wanted to note that about 30% of borrowers indicated that they were still looking for help. I'm sure that all of us would like to have a little bit more money to pay off our student loans. In addition to the survey that was sent out to borrowers a month to maybe even 6 weeks after counseling. Immediately following counseling, we distributed a counseling session or a counseling rating scale that was developed by the counseling and family therapy faculty as the same member who designed the training and delivered the training, the communication skills training for counselors. And what the rating scale consisted of was 4 general areas. If the borrower felt heard and understood and respected, if the counselor and borrower worked on what the borrower wanted to work on and talk about, if the borrower's level of concern about repaying their student loans had changed, and if their feeling of control over their finances had changed. We wanted to do this so that we could take and compare the session scale, or the rating scale between the first session, second session, third, fourth, and so on, to see if there was significant difference. Just the preliminary analysis indicates that 92% of respondents rated each of the 4 areas with a score of 9 out of 10, score higher than 9 out of 10. Of course, we're working on this to compare the session rating scale between the first, second, and third sessions, and hopefully we'll have that information soon. In looking at lessons learned from conducting a program like this, obviously there's a demonstrated need for the program. When we started out, we weren't certain if we'd be able to market to and reach the financially distressed borrower, but obviously we were able to find them. Definitely must be provided as a separate service. Student loans are complicated, time-consuming to sort everything out. We also feel that the service should be provided at low cost or free for borrowers. It must be delivered by outstanding professional counselors who are well-trained and knowledgeable and who adhere to the counseling protocol. Fidelity to the program protocol is vital. Again, we're working on that consistency of delivery of treatment. And of course, systems to monitor the counselor performance. Follow-up sessions, can't stress that enough. It's vital that you build that rapport, that relationship, but perhaps even more importantly is the action plan progress. I feel that a borrower will be more apt to complete those tasks because they know, oh, I'm scheduled to go in again in 3 weeks, so I have to contact that servicer. I have to get this paperwork. Those things are important, and of course, time is important as far as the student loan repayment is concerned and getting it current. So the follow-up is extremely important. Third-party evaluation, we need to know how the program's working. We need to know if the protocol is being followed. We need to know about ongoing things for revising, keeping in mind that we're always trying to get better, but particularly knowing if the program is working. I think it would be important in the future to integrate the various training processes. When we first started out, they were very segmented. That would be a goal. However, definitely there's a need for ongoing training because student loan repayment is always changing, always becoming updated, and there's always something new. So it's important to have professional training on student loan repayment for changes and updates. And technology is always a challenge to collect and organize data so that it can easily be analyzed. So hopefully in the future we can address technology as well. Future expansion plans as far as the center is concerned for this program with additional funding. We hope to expand the program. Right now our focus is on a replicable campus-based community counseling center. We want to target financially stressed borrowers in repayment, particularly helping the non-completers possibly complete their education. The benefit of this would be, of course, enhancing the borrower's opportunities for financial advancement. And because the jobs outlook for the future looks like many jobs are going to require a college degree. So it would help the region's workforce as well as the individual borrowers to have those college degrees in hand. So that is one aspect that we're looking at. The Center for Excellence in Financial Counseling is committed to maintaining the program's quality and delivery of counseling protocol, but we're happy to work with others who have the same commitment to providing quality programs for student loan borrowers. Quality programming, I should say. So we appreciate your interest in our work. We are, again, the Center for Excellence in Financial Counseling. We're part of the School of Public Policy Administration at the University of Missouri, St. Louis. And I could be reached through our website or directly with my email for any other information. So I thank you, Hallie, for this opportunity.
Wow, thank you so much, Vicki. That was just a really comprehensive and a lot of really great information. We do have quite a few questions coming in, so I'm going to go ahead and send some of those over to you. So first of all, I have a question surrounding the, basically about the recruitment of the counselors. So number one, how did you go about recruiting the counselors? Number two, how did you get the borrowers to reach out to you? And this kind of gets at a similar question that was about the marketing of the program. How did you go about marketing the service? How did most borrowers find out about the service?
Okay. As far as counselors are concerned, we pretty much looked for a counseling organization that was willing to implement the protocol and, do the reporting, collect the data. So it was really kind of an agency-wide thing. We found through our previous experience that we really need to have the buy-in of the CEO in order for this program to work, and that there was real focus on providing student loan borrower repayment counseling. So it was basically an agency-wide thing, and or an organizational-wide thing, and we looked for, again, a CEO or executive director who was committed to such a program, and then they nominated, or they either had all of their counselors go through the training or part of the counselors. So as a pilot program, there was a lot of unknowns for all of us, including the providers, as far as how this would work and how this would happen. And reaching out to borrowers from reports that the providers presented to us monthly or reported monthly, we wanted to know how they were marketing the program. And many of them marketed through workshops and got quite a few people to schedule appointments through their workshops, particularly Housing Counseling Organization. But for the most part, borrowers came in through word of mouth, which was kind of surprising to us. It seemed like, they told a friend, told a relative or whatever. But that's how we were able to reach out to borrowers, perhaps as much through word of mouth as anything. Marketing, I think I mentioned very briefly that we did develop some brochures and posters and letters to other nonprofits to let them know that the service was available. The success of those, I think, was probably overshadowed by word of mouth, but that is something we probably need to look into some more as far as analyzing data. So we've just begun that aspect.
Great, thank you. And this question pertains to referral or legal referral. So how did the counselors determine if a borrower needed that legal consultation?
Well, pretty much we relied on some information from that the legal services people gave us. We had kind of a checklist approach to that, and counselors became quite familiar with their legal services attorney and were communicating with them quite frequently. But we had kind of almost an intake process, if you will, and now it certainly wasn't something that we would prevent a borrower from seeking legal consultation, but we also did not want to, fill up all of our slots with needless, legal consultations that weren't necessary. So there was a lot of help and guidance on the part of the legal services folks, and the counselors after a while became so knowledgeable that they pretty much knew when this was something that they needed to do, was the legal referral.
Regarding the third-party evaluation piece, when exactly was the third-party engaged in that evaluation process? Was it throughout the entire pilot program, or was it at the end, or how did you go about engaging that third-party evaluator?
Yeah, thank you. Immediately when we decided to design this program, we knew that we wanted to evaluate the program, and we knew from experience, and it was our understanding that it was important to look into evaluation early on rather than late in the process. So early on in developing our inputs and looking at our outputs and our outcomes, we worked with the evaluator so that we were ready to go with that in our program design with that idea in mind, so that we were not looking at outputs as being our outcomes, but that we were looking at other outcomes, real bona fide outcomes as well.
Great. So you talked a little bit about the scale where counseling participants were able to rate how much they felt heard, or how their what they talked about within their counseling sessions was directed by what they wanted to talk about. How did the counselors go about determining that? Did the intake document lead the content of the counseling sessions, or was it just a conversation? How did you go about designing that aspect into the program?
Good question. Actually, the intake process is, guided, or it's pretty much dictated by what we need to know to help get the borrower to their available repayment options. The counseling communication, the way that happened, and making certain that the technical aspect of student loan repayment counseling didn't overshadow counseling skills, counseling techniques. We were trying to create a balance between that. So with the scale, it was interesting with the 4 questions. Almost always the first 2 were very positive, that, yes, we worked on what I wanted to work on and talk about, and I felt heard and respected. It was the last 2 with if they felt that their concerns about their student loans were lessened. For the most part, they were, but those were always rated lower than the first 2 questions. I mean, still rated very high from what I recall. And again, we're still analyzing this data. But again, we wanted to make certain that the counseling communication skills training and the whole aspect of counseling, again, was not being overshadowed by the technical skills. Excuse me. So that's where that came from. Okay.
Okay, excellent. Let's see. I have question. Okay, so why exactly? And I think this pertains to a slide that had stated that this was a position of the program. Why is it recommended, or why does your program recommend that student loan counseling be a standalone service?
From our experience, borrowers would be distracted by other things that we're working on. If you included everything, I think you'd have a very, very long counseling session. As it was, we tried to keep this to an hour and a half, excuse me, counseling session. I think that you're going to run into problems with a borrower's attention span, and depending upon their situation, this could be a very complicated, very complex situation. So standalone provides the opportunity to look just at student loan counseling. It's great then to refer if there's a housing situation or a credit card situation, to have that be a separate counseling session, or at least be segmented so that you knew that you were concentrating totally on student loan. I think as much as anything, for distraction purposes, it's important to have it be a standalone. I think it's also important because for a counselor to become a very good student loan repayment counselor, they have to be pretty in tune with all of that knowledge and information for helping a borrower with their student loan situation.
Great. Gosh, plenty of questions coming in. I'm gonna go ahead and give you two more questions, Vicki, and then we'll probably
Okay.
have to cut it off.
Okay.
But the first, let's see, I think this might be a good question to get to. What do you see as the role of the financial aid office or the bursar's office in terms of managing their defaults? Do you see this taking the place of that, or is this in partnership, or go ahead and respond to that kind of question.
When we first started out on this project, we were focusing, and still do, focus on borrowers who are well into repayment. I know the age of the borrower doesn't necessarily indicate that they are well into repayment, but we were not intending to in any way be part of exit counseling, if you will. We were strictly looking at the borrower that was in repayment and probably forgot about what they were told in exit counseling and felt that they really had no place to turn, and they just did nothing. So we were hoping that we could work with that borrower that didn't know where to go, where to turn, where to get help. You know, I think it's important that there is some continuity, of course. I mean, there has to be continuity between financial aid and the bursar's office. No, I think eventually, you know, there could be, you know, some interaction or some help, and I think it would be interesting for, you know, the word to get out to borrowers that, you know, I went to school here, maybe I could get some help. Even though I've been away from school for 5 years, maybe they could give me some help. And if they contact the financial aid office or the bursar's office, I think it would be marvelous if that referral could be made to a service such as this, you know, an impartial, neutral, unbiased provider of student loan repayment counseling.
Great, thank you. And then I'm gonna go ahead with the final question, and it's kind of wrapping up a whole bunch of questions that I keep receiving, and it pertains to how can my organization provide this program? Is there training for this program? Are the intake forms available for this program? This type of question. Basically, where can people get their hands on this type of training or access to your program?
Well, as I mentioned in the slide presentation, that CEFC is very committed to maintaining the program's quality and delivery of counseling in the protocol. And quite honestly, we'd be very happy to work with those who have the same commitment to providing that kind of quality programming. And to be very frank, the problem is funding. So we would love to expand this program, but the funding is necessary to do that.
Fantastic. We are right on time, so I'm going to go ahead and wrap it up. I really would like to thank Vicki Jacobson for her excellent presentation. Very informative, very well-rounded, lots of comprehensive information, like I said, surrounding this pilot program. So I have listed in this final slide right here that there is more information, or you can go and see the white paper on this pilot program at the website listed. And again, I will be posting the PowerPoint slides as well as the recording of this webinar on our website, cfs.wisc.edu. I'm also going to send out a follow-up email that has the recording of this webinar as well as those PowerPoint slides that do have all of this information for your perusal after this live event today. So stay tuned for that. That will be within the next 3 days approximately. I will be sending that out. So our next month's webinar invitation has not been sent out yet, but I would like to remind everybody that we do have a monthly webinar series, of course. It's kicked off with this great webinar event. October's webinar is going to be focused on the Affordable Care Act information and resources surrounding that, very specific to Wisconsin and Wisconsinites and Wisconsin practitioners. So stay tuned for that webinar invitation. Again, I would like to thank everyone for joining us, and thank you very much to Vicki Jacobson.